Welcome everyone to the Step Up for Skin Health Hill Day Know Before You Go webinar. I'm Killian Lozak, Director of Advocacy and Membership at SDPA, and I'm joined today by PA Deborah Horwitz, Chair of the Government Affairs and Advocacy Committee. We are so excited that you're here to get prepared for an empowering day of advocacy on Capitol Hill. We'll be walking you through everything you need to know, from logistics to legislative priorities, to make your voice heard. Let's jump right in. Here's what we'll cover in today's session. We'll start with the welcome message from our very own Government Affairs and Advocacy Committee Chair, Deborah. Then we'll review our Hill Day schedule, go over what to expect in your meetings, dig into the legislative priorities, and finally give you tips for telling your story effectively. At the end, we'll open it up for questions that you may have. And I'll pass it over to our very own Deborah Horwitz.
Hi, everyone. I just want to take a moment to welcome you all and tell you all how thrilled I am to see this incredible group of Durham PAs and how ready we are to step up and advocate for our profession and our patients. Hill Day is one of the most important initiatives we do as an organization. It's our chance to tell Congress what we see in practice every day, the challenges our patients face, the care gaps we're trying to close, and the essential role we play in dermatology and in healthcare in general. In fact, I think our last Hill Day in DC was my first time at SDPA, so it was really important to me, and I'm really excited that you all will get to experience it as well. And for those of you who may not be familiar with my background, I actually used to work on Capitol Hill prior to becoming a PA. I graduated from American University in DC with a degree in political communications, and I've always felt like my communications background has helped me be a better healthcare provider in my ability to discuss complicated medical information in a way that patients can understand and take in. And now I'm getting to use the other part of my training and take my experience as a Durham PA and communicate that to lawmakers. So in the hope of making change and leading to legislation wins for us as dermatology providers. So I'm thrilled to be with all of you tonight. And when we unite and bring our stories together to lawmakers, we can make an impact. So thank you all for showing up, for caring, and for taking the step to create real change. Let's make this a Hill Day to remember. I'm also happy to take any questions as we go along.
Thank you, Deborah, for those words of inspiration. Let's get right into it. Here is the full schedule for Hill Day. We're going to start bright and early at 7:30 a.m. with the welcome breakfast and introductions with the group where folks can mingle and get excited for the day. We'll then take at 8:30, we'll take a group picture on the Capitol steps to get everyone who's part of our organization. And then we'll begin our congressional meetings, which will run from about 9 to noon. At this point, we'll break for a luncheon with a policy forum at a location that is to be determined, but it will be on Capitol Hill, most likely on the Senate side. And then we'll continue with meetings in the afternoon. Afterwards, there's an optional advocacy CME program and a reception at the Marriott Marquis. It's going to be a full, exciting day. And I'll kick it off to Deborah to talk about our welcome breakfast.
Yeah, we'll kick off our day at our new SDPA office, which is at 400 Virginia Avenue Southwest. Don't worry, we'll help everyone get there. We'll either Uber there, or there is metro service from our hotel straight to that part of the mall. And so we'll get together at 7:30 for coffee and food so we can get our nutrients on before we get up to the Hill, and then we can have a chance to meet everyone, meet our fellow advocates. And this is when we'll also get our schedules, our leave behinds, which is what we actually will leave with the people we meet with in case they have any questions or want some more information from us. And this is where we'll also get our SDPA white coats, which I'm going to talk about a little bit later. And so this is also a great time to connect with other PAs, ask questions, and build that team energy before heading to the Hill. This will also help us help you see who you might be going around the Hill with, because we'll eventually be breaking you into groups by state or district. And so no one will be in a meeting, hopefully alone. And so you'll have a chance to meet folks before we get started. So you have an idea of who you'll be walking around with and who you'll be in meetings with. All right, so what are we going to wear? I mean, that's my favorite question. SDPA is so graciously providing us with custom white coats for Hill Day, which I think is going to really help us stand out. I think it's always important to have sort of something that unifies a whole group so that like when you're walking around Capitol Hill, they're like, hey, who are those people in the white coats? And it's like, hey, we're Durham PAs. So that's really awesome. Thank you, you guys. So underneath that, we would recommend wearing professional business attire. So that's like a blouse or a collared shirt. No jacket is needed. Remember, this is DC in June. It's going to be hot and humid. So just keep that in mind. So besides that, skirts or pants. And then make sure you wear comfortable shoes. There's going to be so much walking between the Metro and walking between the Hillside and the Senate side. I always say my feet expired back on Capitol Hill probably 15 years ago. So just, cute but comfortable. And let's see, you're going to go through a lot of security lines. They could be long sometimes, so just keep that in mind. And it's going to happen multiple times throughout the day. Every new office that you go into, there's going to be a different security line. So you want to travel light. Everything, all you need is your phone and your wallet, and then everything else will be provided by SDPA.
Thank you, Deborah. And let's talk a little bit about logistics on how Capitol Hill is actually split. Interestingly, Capitol Hill offices aren't in the big Capitol building that you see on the National Mall. It's split into two sections. One side is for the House of Representatives, and the other side is for the Senate. All of these offices can be found easily on Google Maps, so don't worry about that. But let's start by breaking down the House offices first. When you have meetings on this side, they will be in one of three buildings: Rayburn, Longworth, or Cannon. Your meeting schedule, when you receive those handouts, will list the room number and floor for you. And if you always need help, you can give us a call. Each building, as Deborah mentioned, will have security, so plan for extra time to get through and travel light. During the summer is fly-in season, and so there's going to be a lot of folks and a lot of lines. And so we really recommend nothing more than your wallet and your phone. Now let's talk a little bit about the Senate side. The Senate meetings will take place in, again, three buildings. They're called Russell, Dirksen, or the Hart Building. Again, check your schedule for the exact room numbers, but we're always there to help for you and plan for those security screenings. You'll see that these entrances are sometimes very tight and they only let one person at a time. And so don't worry, it's a great time to talk to other folks, talk to staffers who may be waiting in that same line with you, as it's really an opportunity to gather up that excitement for your meeting. And all of these buildings are within walking distance of each other. But you're really going to want to wear those comfortable shoes. There's a lot of ground to cover. It won't take you longer than 5 to 10 minutes to get across the Capitol, but it's really important that you wear those comfortable shoes. And Deborah, I had a question for you. What can you expect in these meetings?
Great question. They're surprisingly short. They may only be about 15 minutes at most, and they're often with young congressional staffers. So you might be really surprised when you're walking in the room, depending on what point you are in your career, being like, hey, these folks, these very important people that work in very important offices are actually quite young. So I think that's can be a little bit surprising. And so I don't want that to be disarming to anyone when they're like, hey, I thought we were meeting with a member. Sometimes you will, sometimes, or most often, it will always be a staffer. And that's okay. So remember that these staffers, they take meetings all the time, day after day, all day long. And so everyone thinks that what they say is important, but you really want your story to cut through and be memorable and be persuasive enough to stand out so that the staffer actually thinks about you and hopefully reports back to their boss at the end of the day. That's really the goal. It's not just that you get through to this staffer, it's that you're eventually getting through to their boss. So occasionally you might get to speak directly with the legislator. So be ready with your elevator pitch. Tell your story, make it memorable, and then personal stories are really what sticks. Elevator pitches is when you tell someone who you are and what you're about in sort of a quick flowing few sentences. Remember your pitch that you gave at your PA school interviews? It's kind of like that. I'm going to give an example of mine. So you might say, I might say, hi, I'm Deborah Horowitz. I'm a dermatology PA or a physician assistant that works in dermatology. I see patients here in DC at Sibley Hospital, and I take care of patients and make medical decisions, prescribe medicines similar to a physician. Today, I'm here to talk with you about alopecia areata and vitiligo, which are progressive and disfiguring medical conditions, and they're often miscategorized as cosmetic problems. More on this in a minute. So my advice is for you to practice your elevator pitch, just like I did. I think it's really great to write it down and make sure that you're telling your story, what you're asking for, and that is what is so important and is really going to cut through and be so impactful in all these meetings.
And there'll be plenty of opportunities to practice with folks with you on the fly-in, and also with us. We're always happy to be a sounding ear. Now we'll take a little bit of questions on logistics. We'll take a quick pause here. Please feel free to drop them into the chat. Let us know if you have any questions or concerns about how do you get there, where the location is, anything that may come to mind. We're happy to answer any questions. As we wait here for some questions to come in from the audience, Deborah, what can you tell us about last year's Hill Day and how the impact that you guys had?
Yeah, so last year I'm going to talk about this a little bit more later, but we did a Hill Day for AAPA, which they often do in the fall. And so there's always certain asks that we ask for in terms of legislative priorities, but they usually have more to do with PAs writ large and sort of making sure that PAs have the same, scope that other providers have and other AAPs have. So that's what I think this Hill Day is so exciting, is that we and our committee got to pick our legislative priorities and work with you and figure out things that are actually really important to Durham PAs, especially when we talk about vitiligo and alopecia areata later. That's something that every single person in this room can speak from their heart about and tell a personal story about one of their patients.
Thank you, Deborah. We got a question about an additional discounted night for Tuesday night at the Marriott. I don't believe we have an additional discounted night right now, but we can double check and we can get back to you. I got a question about what about bringing a clear bag? Not quite sure what that's in reference to. Deborah,
so that's in terms of security.
Security, got it. Oh yeah, a clear bag will help. Really, they're going to want to scan everything you bring with you. And so whether it's in a clear bag or not, it's going to go under. It's very similar to airport security. And so that's what you can expect when you go there.
And then it doesn't have to be a clear bag either. Like I bring a tote. So
yeah. And I would really recommend if you don't need the bag, or if it's easier for you to not have anything, I would really push for that. When I go on Capitol Hill, I have my wallet, my papers, and my phone, and that is it.
Easy for you to say.
Yes. We just got another question about, will we be speaking to both House reps and Senate members, and will teams split to see just one side of Congress? So yes, we will be doing our best to make sure that you have meetings both on the House side and on the Senate side. Teams or groups will be formed, but you'll be traveling through both the House side and the Senate side. Our goal is to get you in at least 3 meetings for 2 of your representatives and your senator, or your 2 senators and your 1 representative. Apologies. And so you will get plenty of experience going to both sides, and we'll help guide you. And we're always there if you need help finding that.
Killian, didn't you mention that if someone had a relationship, maybe they don't necessarily live in their district, but maybe their parents are friends with somebody, or they just have had a relationship through somewhere they used to live, maybe they're not current district members at this time, letting us know about that so we can maybe arrange a special meeting, even though that's not going to, specifically be conveyed just by their zip code.
Yes, please feel free to reach out to me. If you have a personal connection with an office or a specific member, please let us know. We would love to get you in that office. Really, the opportunity for us to be there and utilize the connections that we have, whether they're work or personal or what they are, only help advance the PA profession and what we're trying to do on Capitol Hill. So please feel free to reach out. I'll make sure, if you haven't already, if you haven't signed up, you should have my email, but I'm happy to provide that as well after this webinar. I don't see any more questions right now, and so let's dive straight into the fun part. This is where my policy nerd side gets excited here, talking about the legislative priorities. During this Hill Day, we're going to focus on 3 core legislative priorities. This is something that the Government Affairs Committee have put together, and we really think is not only timely to what's happening in Congress, but important to the PA profession and the patients that you serve. And so the first one is access to treatment for patients with vitiligo and alopecia areata under Medicaid. The second priority is Medicare physician reimbursement reform. And the third one will be copay accumulator program reform. Each of these directly affect the PA's ability to practice and provide care to your patients. Let's break them down. First, vitiligo and alopecia Medicaid patient access. As you guys know in your practice, these conditions are often misclassified as cosmetic by Medicaid programs, specifically by state Medicaid directors, and that ends up meaning patients get denied treatment. We're asking lawmakers to support legislation requiring Medicaid coverage for these autoimmune conditions. When you're in these meetings, we really highly encourage you to share examples about how these denials have affected your patients. It drives that message home. Are there any and as I go through these, people, please feel free to put questions in the audience chat. We're happy to answer them as they come through. I'll keep moving through these, but can answer any questions as they arise.
So just as a point of clarification, there isn't a specific law, that's being, if that's on the House side or that's on the Senate side right now that's being endorsed. So this is sort of like a educational, informational ask, as well as hopefully maybe when someone will be so inspired and motivated by us that perhaps they might be interested in co-sponsoring a bill. Is that?
Yes, and we're working right now to push lawmakers to introduce this bill. And so with your voice, we can really drive that message home. It also happens to be World Vitiligo Day on June 25th. Yeah. And Austin, I just saw a great question from Austin Hardy in the chat. Are we able to provide photos of these conditions? Assuming you're not violating any HIPAA regulations, please do. It does drive the message home, and it really can show and tell the story of a patient who's dealing with it and how you have to guide and help these patients with that process. So thank you for that question.
Yeah, great idea.
The second one is Medicare physician reimbursement reform. I'm sure you guys are very familiar with this. This has been on our priorities for SDPA for a little while, but now we're advocating for the support of specifically HR 879, the Medicare Patient Access and Practice Stabilization Act. Cuts the physician's reimbursement and hurts practices. It impacts your ability to serve Medicare patients, and it puts your practices at risk. We're asking legislators to co-sponsor this bill to stabilize patients and ensure continued access to care. And in a little bit, Deborah's going to tell us about how we can make sure that we're really driving that narrative home so that policymakers resonate with that. I'll go on to our third legislative ask. This is our last one. Copay accumulator programs. Copay accumulator programs make treatments unaffordable for patients by excluding copay assistance from out-of-pocket limits. These often leave patients with unexpectedly high costs when their assistance runs out, and in essence, allow pharmacy benefit managers to double dip. The Help Copays Act, S864, would fix this. We're urging lawmakers to support this bill and protect skin patients from unexpected costs that disrupt patient care. Before we go into how do we frame this story, are there any questions from the audience chat? And Deborah, can you tell us a little bit in your case about how Medicare reimbursement can impact patients?
Yeah, and I think a lot of people have seen this. I might touch on it in one of my slides, but we've all maybe worked in or heard of practices that no longer see Medicare patients, and it's because of these cuts to reimbursement, and it's not really worth it to the practice to see these patients anymore, and so we're not even taking them, and so that is getting shifted to other offices around the area, and maybe their burden of Medicare is going too high, and then their typical proportions aren't like they used to be, or those patients are just straight up going without care, and those are our patients that need us the most, who most commonly have the most skin cancers and more severe disease burden. So that's just an example of the Medicare reimbursement story. And then I guess I wanted to, I don't know if anyone else had this question, but I was thinking in terms of how the copay manager reform really worked. It kind of sounds like to me, like, let's say I put a patient on a biologic and their copay for their biologic was maybe $100 a month. Maybe that's one of their only medications, like otherwise they're pretty healthy. And so every month they've been paying for their medication. And then by month 5, when they paid $500, thinking, okay, I met my out of pocket max for the year. And then they come to find, and they have to go pick up a prescription, a different prescription. And they're like, hey, why do I have to pay? Is that how it works?
Yeah, really, in essence, is when there's a manufacturer coupon, if a patient is receiving a manufacturer coupon because they're trying to help alleviate that $100 bill for that medication, patients will use that coupon at the pharmacy counter. And they think that that's applying to their out-of-pocket deductible, right? Because it would make sense. But eventually they keep using this coupon card and it runs out at some point, and then they get strapped with the bill later on from the pharmacy benefit managers. And so that's really what we're trying to address. And thank you, Deborah, for explaining a little bit on the Medicare reimbursement, how that impacts your practice. I'd love to have you talk about how can we frame this, all of these priorities, to really tell a story that's going to construct an effective narrative that's going to land with policymakers and their staff.
Yeah, again, this is, I think, the most important part and where we can really stand out. And I think this is a way for you all to start to feel more comfortable with, I don't know that much about what Killian was just talking about. I can't even repeat what he said. I don't know that much about Medicare, reimbursement, but what you do know is what you do every day and how to tell your story that connects to the policymaker and that connects you back to your patient. You do see your patients every day. So I think this is the most important part of this webinar, is that this is something that SDPA is providing for our fly-in that I've never gotten at any other, fly-in or advocacy work that I've ever done. They sort of like hand you a bullet pointed talking points, and then it's like, hey, go for it. And then you're like, oh, I got a piece of paper. What do I do? And so I really like how, we have put these, framing your story slides into this talk. So again, you want to introduce yourself and explain your role. If you're nervous, you can go on for a while about being a PA, because that's something that you do every day that you don't, I'm sure you don't have too much trouble talking about, what a PA is, what you do as a dermatology PA, like make that sort of your home base, and you can just stay there until your nerves kind of settle. And then you want to connect each policy issue to your personal experience with patients. And so we've already given a lot of examples, but just generally speaking, have you ever had a patient denied a treatment who was on Medicaid coverage? Have you ever seen how reimbursement cuts affect care? That's what lawmakers really want to hear. So let's see how we might frame it specifically for vitiligo and alopecia. Okay, so here's an example of how you might do an ask for this. You might say, I'm here today to talk about vitiligo and alopecia areata. If you need to show pictures or sort of explain a little bit more about that, what that looks like or what it is, then you have, something else that you can say, like, these are serious autoimmune conditions. They're not cosmetic, and denying treatment impacts my patient's well-being. I ask that you introduce legislation, or maybe become more aware of this, to potentially introduce legislation to ensure that these treatments are covered. So make it your own, speak from your heart. I think that this ask is specifically a lot easier for us to talk about, because it really affects our day-to-day practice, where we see these patients every day. It's not sort of like the infamous diabetic shoes, no offense, where we don't really connect with that specifically. So as a derm PA, you can easily remember a patient or discuss an impact these diseases have had on patients, and how we have these newer classes of medicines, which are sort of primarily the ones that are not being covered. And those are becoming so effective and curative, but patients aren't getting access to these drugs and these treatments. So again, really sort of illustrating how the medical paradigm has shifted, and these diseases have always been the same, but people need to think about them in a different way. And you can show pictures. I love that idea. We may I don't know, Killian, I don't know if I should say, we may have a patient that might be, some patients that might be circulating around that are also active within their own disease community. And so again, these are different ways. And then, just saying like, look, I have a patient who's like 80% with, doesn't have hair on their head. And I really want to get them on a certain class of medication that's a more expensive, newer class of medication. And that's basically the only way to cure this completely debilitating, quality of life affecting disease. So I think that this ask, even though there's not a bill that goes with it, I think it will be fairly easy for you all to kind of riff on this one and be able to kind of just speak from the heart and talk about it. The next one is the Medicare physician reimbursement. And so as we sort of already talked about, Medicare cuts to physician reimbursement are hurting dermatology practices. We want to continue caring for our elderly patients, but it's becoming harder every year. Please support HR 879 to stabilize Medicare reimbursement. So that's like a really nice, succinct way for that ask. So what's cool about this slide and the next slide, which I'm not quite ready for, is that these already have our HRs on them. What does HR stand for?
House Resolution.
Thanks, Julian. So just for everyone. And so that means that it's a bill that's been introduced already. And so again, this is sort of like our meetings 101, like sometimes the staffer is like, oh yeah, like I know that one because like they're on the health committee or like they already are very familiar with it. If they have nothing to do, if they're the person they're representing has nothing to do with where this bill is in Congress right now, they may have no idea what it is and they need to look it up. So you could potentially give them time to look it up because I think they have like some way of looking it up on their phone, or then you can pretty easily go into it and say, this is the bill that's supposed to stabilize Medicare reimbursement. We're trying to, we're trying to decrease the amount of decreases that are going to Medicare reinforcements because, as I already mentioned, many practices are no longer taking Medicare patients. So again, I don't know if staffers on the Hill know that. They don't hear that maybe from their constituents as much as they can hear that from us as healthcare providers. And so practices are saying it's not worth it to take Medicare patients anymore. So again, these populations are getting shifted into other offices. And so then their proportions are going way out of whack, or they're not getting treatment at all, like I mentioned. So this, like Killian mentioned, has been on our SDPA legislative agenda for a while now. And so just so you know, the SDPA always opposes any cuts to Medicare. And luckily right now there is a bill just to do just that. And so we want to discuss that specifically at each office. And then our final bill is our copay accumulator program reform bill. So this is a little bit of, departure is a little bit strong, but this is a newer legislative area for us. Well, we did the copay accumulator program before, but now there's actually a bill again. And so we're trying to hop on this again. And so the way that you can frame this is by saying copay accumulator programs make it very difficult for patients to afford their medications. When copay assistance isn't counted towards deductibles, patients face unexpected costs. Sometimes they have to stop their treatment. Please support Senate S 864 to fix this issue. So again, you can point specifically to the bill, and then you can go straight into, I have a patient just like this. Like she just told me, she already told me she's on Otezla and she's using a copay card right now. And they already told her, my PA nurse already told her, my prior auth nurse already told her that it's going to run out at a certain point and she's going to owe $1,000, when it comes to an end. So again, I hope that all of this is kind of giving you an idea of how to sort of start thinking about these asks and not feeling like, oh my gosh, what should I say? What should I do? So any questions with any of those?
Thank you, Deborah. And as we wait for questions, I would love to hear from you. What are the different ways and the key to a successful meeting? What does that mean for you as a PA who walks into these meetings on Capitol Hill?
Yeah, so I think I have a few final tips. So you want to listen carefully and take notes, just like you do with the patient. So I think we're all pretty good at that. Um, I want you to sort of come away having an idea of whether it felt like the staffer was interested, real interested, or fake interested, and whether they were receptive to your ask. Because I think it would be great to be ready to let us know whether or not we should circle back with that office to see if maybe they might be interested in co-sponsoring. Like, did they seem really interested in the alopecia areata vitiligo sort of thing, or did they seem like pretty skeptical the whole time? I've been in meetings like that too. In political science 101 class, we learned about the sinners, the saints, and the savables. So we have our saints, which we know are on our sides. We have our sinners, which we know we are never going to get them on our side, so may not waste any time with them. And then we have our savables. So we're really looking for those savables where they seem interested, but we want to circle back with them and see what they might be willing to do. You want to ask for business cards so we know who to stay in contact with, who you actually met with. And then don't stress if you don't know an answer. You can always say you're happy to find out and get back to them. And then actually that gives you a really good reason to get back to them. Because I personally, you're supposed to write a thank you note. That's also why we get the business cards. But I always feel like it's a lot more genuine when I'm like, hey, you asked about this question. I'm just getting back to you to let you know this is what I found out. Here's a policy paper that we can help you with that's attached. And so I feel like that's a lot more genuine than just like, hey, thanks. Again, you want to cut through and you want to be memorable. If you attach something that's helpful to the staffer, they're going to remember that. Because again, keep in mind, young folks working on the Hill, they don't know about everything. They may pretend like they do, but they may not. And so the more that you're able to educate them, the more grateful they're going to be, because they can't be experts on everything. We're the experts on what we've come into the room to talk about. And then you're going to give them your expertise in our 3 asks. I want you to stay focused on our priorities. So if they start talking about something that's going on in the district, some football game or somebody that they know or you guys know in common, just like you keep a patient on track, keep the meeting on track. Know why you're there and what you came to ask for, and ask. And then always thank them for their time, of course. And you've got this. So I'm really excited for everyone.
Thank you. That's fantastic, Deborah. Really appreciate your insights here. Before I get in, I see a few questions already. Please feel free to start adding questions on the chat. Before we open it up, though, I would really want to reiterate that it's not too late to join. You can secure your spot by taking this QR code, taking a picture, filling out the survey. Participants will have also an opportunity for an open forum town hall with Deborah and myself, where we can really connect one-on-one, take some more individual questions specifically about what's going on. And so it's really an opportunity for you guys to ask more questions and network with the fellow advocates that are going to be there with you. And then into the questions, I'm starting to see some questions already. One of them, yes. Will we be trying to discuss all 3 topics and ask in each meetings? Yes, you are. The idea is to get to it. It's not the end of the world if you don't get to all 3 priorities. And in some meetings, it may make more sense to focus on one towards the other, depending on interest. Deborah, what are your thoughts on this?
Yeah, I think that that's exactly right. I was going to answer it similarly and just say, like, you may not get to all 3, but the goal is to get to 3. So I would say if you have, if you get a staffer or maybe a member of Congress who's like, oh, they have some personal connection to maybe alopecia areata or vitiligo, that's going to be so much more important to sort of like hone in on that, because then we could really get them to maybe be a co-sponsor than to, be worried and anxious about getting to the other asks. Again, the meeting can go as long or as short as the staffer wants it to. So just like you kind of get a sense of how a patient sort of wants to be dealt with, I think you'll sort of, be, feeling that kind of vibe as well. I think also if you are able and you can ask Killian or I about any insight into like what committees they're on, that also might sort of dictate what you might want to focus on if you are if you're not on the Senate side, you might say like, hey, this isn't here now, but there is a Senate bill that's coming up. So, and then if you're on the House, if you're on the Senate side, then you would say the same thing. Here's the Senate bill. You might want to focus on the Senate bill first because it's already there. And then say, and then there's this House bill just so you have your eyes on that for when it comes through to the Senate. So kind of like making them know, feel like they know that you know what you're talking about. So, yeah.
Yeah, and we'll prep you for all of that. We'll make sure that if there's a specific member on a committee that we really need to hit really hard, right? We'll let you know. Don't worry. I mean, we would love for everyone to do their own research and feel really comfortable with who they're talking with. But we also know that you guys are busy, and so we're really here to empower you and help you on this journey. Got another question here about whether this webinar will be online for folks to review. Yes, this webinar is being recorded and it'll be available online. We'll also be posting some tidbits on social media. Please share with your friends, get colleagues that are interested in joining. We're really trying to get our numbers up for this Hill Day. Right now, we have about 50 registrants. So no, you're not going to be alone in this. It's going to be really quite an event, and we're really excited. I think if there's anything that you can take away from this webinar, I know Deborah and I would really want to hound that policymakers, they want to hear from you. And the truth is they don't. Most of the time they spend in these basement offices in these buildings, really, looking at bills, working with other folks. And it's really important for us to get our voice out there and for PAs to talk about what they're doing, how that impacts patient access, and how that impacts the larger healthcare landscape. And so this is really that opportunity. We got another question about have there been any potential sponsors for a vitiligo / alopecia areata bill, or thoughts about who might be a good target. I can tell you, yes, we are working on some things, and we're very close to getting a bill introduced. And so I can't speak too much on this yet, but we're really looking forward to getting that through. And we do have some specific targets on specifically, and we'll talk a little bit more about this. This bill would likely live in the health ENC subcommittee. And so those are the ones that we're really targeting. And thank you, Alexander, for that question. And we will definitely circle with you as these are a big priority for us.
And do we know who they'll be meeting with? Sorry, I'm reading Alex's question again. Oh, sorry, wait. Oh, yeah. Are there any, so Alex also asks, are there any specific districts or state that you guys are in need of more volunteers? Like, do we want to target anyone specifically that we don't have to represent yet?
Yeah, no, thank you, Deborah. I think we have a lot of folks from the East Coast. I would love to get some more folks from the West Coast, right? I think we have a lot of people that are joining, and it's obviously a longer trip to make going to Washington, D.C. But if you can really encourage your colleagues from the West Coast to come join us, that would be incredible. The more folks that we can really show who are talking to their policymakers, the more offices that we can hit, the better it's going to position the PA voice and you guys when you're really talking to these people. I got another question from Allison. Will we be more likely be speaking with member representatives in our area in which we practice? Will we know before our meeting, before Hill Day, to do more research on those specific individuals? And the answer is yes. So whatever address you provided on that form is what we'll use for scheduling your meetings. It should be your home address. But if you also have a practice address and you'd like to schedule some meetings there, please feel free to reach out to me and we can work through that, or make sure that you tag along to another meeting in that practice area for you. And yes, in terms of meetings before Hill Day, we are happy to get this out, to provide once we start scheduling here in early May. We will provide you a list beforehand of what offices we're scheduling for you and confirm those with you.
Yeah, I think the goal sounds like it might be you'd have maybe like a week or so's notice in terms of being able to do some research.
Yeah, and we really appreciate your guys' flexibilities. That sometimes these meetings, as you'll see, they might get canceled last minute, but we're really going to make sure that if that does happen, that you get into another meeting, right? No one is going to be left alone. I can tell you this 100%. We'll make sure that you either have someone with you or you're with a large group, and we have an even split of people who have done this and people who have never done this before. And so look to your right and left. Chances are there's someone with you who feels really confident about what they're going to be talking about to policymakers. And so please feel free to lean on your colleagues' shoulders on this.
And I just wanted to make sure I mentioned before we come to a close, if we don't have any more questions, and before you close, Killian, I just wanted to say that maybe you've done a Hill Day before with SDPA, but I hope you can feel a real shift change here. You guys are really getting in on the ground floor of some really exciting legislative advocacy coming from this organization. And it's unlike anything else in the dermatology space. And I've even heard it's unlike what a lot of other medical societies have for their own advocacy agendas. And so we're really sort of positioning SDPA in this way so that we can be more active and have our voice magnified. And so I hope you guys are kind of getting a sense of that. That's really what we're trying to start. And like I said, you guys are getting in at the very beginning of what we hope to be a much more common activity that hopefully you want to participate in again and again.
Thank you, Deborah. And yes, and to close off, we really look forward to seeing everyone there. I know Deborah and I are excited, and we talk about this weekly and think about new ways that we can engage folks and get people on the Hill. And so we're really excited to see you there. Not only there, but if you also haven't registered for the summer conference, please do. We would love to have you at the summer conference as well. We're really excited. And really, this day is about you. It's about elevating your voice to policymakers and talking about how policies impact your practice and your patients. And so thank you guys for taking the step, for those who have signed up, and for those who haven't, we really hope that you do, as this is really going to be an amazing opportunity. Thank you, everyone. And we'll close tonight's webinar. Thank you for joining.
Thank you, guys. Hope to see you guys soon.